This presentation is about diabetes and its causes and prevention. It's estimated that 2.1 million Americans
and 78 million Americans are pre-diabetic. Every year, 3.4 million people will succumb to this terrible disease.
There are three types of diabetes: type 1, type 2, and gestational.
Causes, treatments, and prevention for each type varies. Healthy People 2020 is a government initiative which identifies our nation's health priorities. Healthy People 2020's goal is to reduce the burden of diabetes, improve the quality of life for all affected persons, and to raise awareness.
Healthy People 2020's goal is to reach 79.8 million people diagnosed. We are currently at 72.5 million, and we are working to reach this goal.
I'm just going to talk to you and ask you about a few different questions. So, do you have any of the following symptoms: increased thirst or frequent urination?
Yep, I've experienced both of those.
What about extreme hunger and unintended weight loss?
Yep, I've experienced that.
What about irritability, mood changes, fatigue, weakness, and blurred vision?
Yep, I'm experiencing all of those symptoms.
Okay, thank you. The doctor will be in shortly to speak with you.
Okay, great, thank you.
Good morning.
Good morning.
I'm going to open up your chart. Let's see what we have here. According to the chart, it says you have type 1 diabetes.
Yeah, I was diagnosed when I was 10.
Okay. So it looks like your body's ability to produce insulin is impaired, and as a result, your body can't really metabolize carbohydrates due to lack of insulin. We got your lab work earlier, and it looks like you have elevated levels of glucose in your blood. Okay. Well, the cause is unknown. Usually it's the body building up an immunity against the insulin, but another possibility is genetic. Other possible causes are genetics, exposure to viruses, and other environmental factors.
So what seems to be a problem today?
Well, I've been feeling really tired lately. I'm not getting enough sleep, or I feel like I'm sleeping too much, and my eyes. It's been a while since I've had them checked, and it seems like they're getting worse.
Okay, let's take some more tests. It sounds like you might have to be diagnosed with type 2 diabetes.
Okay.
Okay, so your tests are in, and it does look like you have type 2 diabetes. So a nurse is going to come in here in a little bit and inform you about some information about counseling and insulin with type 2 diabetes.
Okay. Thank you.
Here's your nurse right here.
Hi. So we're going to work on your counseling today. So we're going to have to run a few more tests to figure out which type of insulin you're going to need. So we're going to work on some weight management, more healthy eating, and just making sure that your weight stays within a certain range before, things get out of hand.
Mm-hmm.
So what made you come to the doctor's office today?
I've been having tingling in my hands and feet. I've been having sores that haven't been healing properly, and I've been having more urination than I did with my first pregnancy. I just want to make sure that the baby's okay and that nothing is wrong, and make sure I'm healthy also.
Okay, let me go run some tests. Okay, so in a few minutes, I'm gonna have a nurse come in here and inform you about healthy ways to live with you and your baby with diabetes.
Okay.
Here she is now.
Here you go, doctor.
Thank you.
Hi. So if we don't treat you, then the baby's going to come out either really obese or really sick, and they're going to have a higher risk for type 2 diabetes.
Okay.
Diabetes prevention and management is ultimately the responsibility of the patient, and the healthcare staff needs to ensure that patients have the tools to be their own advocate. As a nurse, the increase of diabetes in the U.S. will have a profound effect. The nurse's responsibility will increase the demand on education for patients in terms of prevention and self-care. This means that making sure the patient is knowledgeable for how to prevent further complications and maintain good health.
Exercise is also considered to be a necessity in a daily regimen for anyone, but some neglect it to another level, which can be another cause of developing diabetes. Studies have shown that just a half an hour of walking or low-intensity exercise daily reduce the risk of developing type 2 diabetes by 58%. Testing and early diagnosis is extremely important. Ways to control diet include being educated about the types of foods one is choosing to take in. Understand that, for example, an average human should take in less than 100 grams of carbs daily.
Since eating carbohydrates ultimately raises insulin levels, carnivores can count on having enough insulin for this process.
Ways to control diet include being educated about your food intake.
The causes of diabetes are often reflected on the lifestyle choices of the person. Poor choices in diet result in a greater risk of developing diabetes no matter how old the person is. Pertaining to carbohydrate intake, according to MD-VIP, the real cause of diabetes, Dr. Louis Malino states, as a result, insulin escorts the excess sugar that cannot fit into the liver and muscles and turns it into fat cells.